Mississippi House of Representatives is now in session. Please let the House come to order. Please stand as we're led in prayer today by the gentleman from Scott and remain standing thereafter for the pledge.
Thank you, Mr. Speaker. Would you pray with me, please? Dear Heavenly Father, we come to you today and we just want to pause and say thank you, Lord. Thank you, Lord, for all the many blessings of life that you blessed each and every one of us with in this room, Lord. We thank you for the opportunity that you have given each one of us, the great responsibility to serve the great people of our state, Lord. We thank you most of all for sending your son Jesus to die on the cross so we could have everlasting life and be saved again. Lord, we ask that you please be with us this week as we go through deliberations, as we finish up the people's business of the state. Lord, we ask that you please give us respect for one another, give us courage to do the right things, to give us empathy for the members of each other and the people of our state, Lord. We ask that you please bless our governor, our lieutenant governor, our speaker of the House, and all of our members, Lord. And we ask that you be with each one of us. In Jesus' name we pray. Amen. Pledge. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Open machine, Madam Clerk. Has everyone voted? Has everyone voted? Closed machine, Madam Clerk.
There's a quorum present, Mr. Speaker.
Thank you, Mr. Clerk. We'll have the reading of the journal. Jim from Rankin moves we dispense with the reading of the journal. All in favor say aye. Opposed nay. Ayes have it. Report of select committees.
We have none, Mr. Speaker.
Report of standing committee.
We have reports on the counter, Mr. Speaker.
Introductions of bills and constitutional amendments. Gentleman from Lauderdale, Mr. Calvert.
Mr. Speaker, I ask for unanimous consent to dispense with the reading of the introductions.
The objection? Hearing none, we will do that. Resolution, petitions, memorials, and other papers.
We have none, Mr. Speaker.
Thank you, Mr. Clerk. We'll have introductions of guests and visitors. Lady from Harrison, Ms. Barnes.
Unanimous consent, Mr. Speaker.
For what purpose, lady?
To change my vote on yesterday's calendar.
Okay, state your request.
House Bill 1295, I would like to change from yay to nay.
Any objection?
Thank you.
Do you have any introductions of guests and visitors? Okay. All right, I don't see any. Lady from DeSoto, Ms. McRae, what purpose you seek recognition?
Asking unanimous consent to change my vote from yesterday, House Bill 1295. To yes, to nay.
Any objection? Change the lady's vote. Gentleman from Tunica, Mr. Burnett.
Thank you, Mr. Speaker. I would like to ask for permission to change my vote on yesterday's calendar, House Bill 1295, from yea to nay.
Any objection? Change the gentleman's vote. Gentleman from Washington, Mr. Hines.
Thank you, Mr. Speaker. I'd like unanimous consent to change my vote on 1295 from yea to nay.
Any objection? Change the gentleman's vote. All right, we will go to the calendar. In conference appropriations. Chairman is recognized.
Thank you. Ladies of the House, let's go to the in-conference appropriations calendar. This would be number one, House Bill 1679, conference report 1679. Recognize the gentleman from Montgomery to explain the next few conference reports.
Gentleman's recognized.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, House Bill 1679 is a conference report on the appropriations of social workers, marriage, family therapists. This bill restores LBR cuts of $2,250 and adds an additional authority of $20,000 for upgrades to the Board of Licensing for regulatory system. Total budget coming in at $22,250 over LBR levels. And that's an explanation of the bill, Mr. Speaker. I'll answer any questions. If not, I'll move final passage.
Questions? I don't see any. Waiting on the gentleman from Newton. All right, open the machine, Madam Clerk. Question occurs on the conference report, the House Bill 1679. In favor of the report, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 115 yeas and 3 nays, report is adopted. Next item.
Thank you, Mr. Speaker. Next item is item House Bill 1680. Call it up, make the usual motions.
You don't have to make the usual motions,
I'm
gentlemen.
sorry.
We're just presenting conference report.
Thank you.
So you recognize, present the report.
Conference report on Board of Cosmetology. Ladies and gentlemen, this conference report on the Board of Cosmetology comes in at $78,143 restored LBR cuts to the 2020 funding level, and adds an additional cost of administration of examinations of $121,500 for a total special fund increase to the LBR of $199,643. And that's the explanation of the conference report. Mr. Speaker, I ask the
Questions
final
on the
passage.
report? I don't see any.
Final passage.
Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1680. You favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By a vote of 110 yeas, 7 nays, report is adopted. Next item.
Item 1681, it's a Board of Psychology.
You recognize.
Thank you, Mr. Speaker. This conference report comes in at $7,000 additional authority for additional cost incurred by the Board of Autism for travel and equipment supplies. So it's a total increase to the LBR level funding of $7,000, and that's an explanation of this budget.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1681. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 115 yeas and 3 nays, the report is adopted. Next item.
Thank you, Mr. Speaker. Next item, House Bill 1682, is the Auctioneers Commission. And this budget comes in, we remove the reverse repealer, and the conference adopted just LBR level funding. And that's an explanation of the conference report.
Questions?
Final pass.
Don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1682. You favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By a vote of 110 yeas and 8 nays, report is adopted. Next item.
Thank you, Mr. Speaker. Next item, House Bill 1683, is appropriations for the Medical Licensure Board. This conference report restores the vacancy cuts of $194,586, an increase in legal fees of $157,750, and fully funds the commitment to the Mississippi Physicians Health Program at $100,000 for a total special fund increase to the LBR of $375,920. And that's an explanation of the conference report.
Questions on the report? I don't see any. Open the machine,
Final
Madam
passage.
Clerk. The question occurs on the conference report, House Bill 1683. You favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. I vote 115 yeas and 3 nays. Report is adopted. Next item.
Thank you, Mr. Speaker. Next item is House Bill number 1684. It's appropriation for the Board of Optometry. The conference report's adopted the LBR level funding and remove the reverse repealer. And that's an explanation.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1684. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 115 yeas and 3 nays, report is adopted. Next item.
Thank you, Mr. Speaker. Next item, House Bill number 1685. It's a Real Estate Commission and Appraisers Licensing and Certification Board. The conference report comes in at removing the reverse repealer and maintains all other language at level funding, and that's an explanation of the conference report, Mr. Speaker.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1685. You favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By a vote of 109 yeas, 5 nays, report is adopted. Next item.
Thank you, Mr. Speaker. Next item, House Bill number 1686. It's the Nursing Home Administrators Board and appropriations for that. And that comes in, we removed the reverse repealer and adopted LBR level funding for that board. And that's an explanation of the conference report.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1686. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 115 yeas and 3 nays, report is adopted. Gentleman from Tallahatchie, Mr. Reynolds, what purpose you seek recognition?
Mr. Speaker, for an introduction on behalf of myself and Representative DeWeese from Oxford, we are very, if the House please, we're very glad to have our doctor of the day, Dr. Kimberly Webb, and her husband, Ted, and she is trying to make sure that we retain our health down here, and we very much appreciate our doctor of the day. So we could make her welcome, and her husband, who works at Mechanics Bank in Water Valley. Thank
you. Next item.
Thank you, Mr. Speaker. Next item, House Bill number 1687. It's the Appropriation for Physical Therapy Board. Again, the conference adopted LBR level funding, and that's an explanation of the conference report.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1687. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By a vote of 114 yeas and 3 nays, report is adopted. Next item.
Thank you, Mr. Speaker. Next item, House Bill number 1688. It's the appropriations for the Board of Nursing. And conference report restores funding to the current field pins of $210,059 and restored remaining cuts to the LBR to the fiscal 2020 funding level at $373,915 for a total increase to LBR of $583,974. And that's an explanation of the conference report.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1688. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By a vote of 115 yeas and 2 nays, report is adopted. Next item.
Thank you, Mr. Speaker. Next item, House Bill number 1689. This is the Board of Barber Examiners Appropriation. The conferees adopted the following changes of $6,590 in restoration of LBR cuts and $12,000 DFA fee increases they're required. It comes in at a total of $18,590. If there are no questions, I move passage.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1689. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close machine, Madam Clerk. By vote 111 yeas, 7 nays, The report's adopted. Next item.
Thank you. House Bill number 1690. This is appropriation for the Board of Engineers and Land Surveys professionals. The conference report comes in at restores LBR cuts to the salaries of totaling $59,443, and funding for the ABET grant program of $300,000. And this total increase to special fund comes in at $359,443. And of course, remove the reverse repealer. So that is an explanation of this conference report. Move adoption.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1690. In favor of the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By a vote of 113 yeas and 5 nays, report's adopted. Next item.
Thank you. House Bill number 1691. This is the appropriation for the Athletic Commission, and the conference report adopted LBR level funding and removed the reverse repealer, and that's an explanation of the conference report.
Questions? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1691. In favor of the report, vote aye. If you're opposed, vote nay. Has everyone voted? Closed machine, Madam Clerk. By a vote of 111 yeas and 7 nays, report is adopted. Next item.
Ready to go?
Next item.
Okay, thank you. Ladies and gentlemen of the House, let's go to item number 39 on the conference conference calendar, and bring up House Bill Conference Report 1718. Recognize the gentleman from Walthall to explain the conference report.
The gentleman from Walthall recognized to present the report.
Thank you, Mr. Speaker. Item 39, 1718 is appropriation for the Board of Registered Foresters, and its LBR comes in at $41,765. Explanation.
Questions? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1718. In favor of the report, vote aye. If you're opposed, vote nay. Has everyone voted? Has everyone voted? Closed machine, Madam Clerk. By vote 114 yeas and 4 nays, the report is adopted. Next item.
Okay, next on the calendar today will be item number 46. That would be House Bill 1725. I recognize the gentleman from Pontotoc to explain the conference report.
Gentleman from Pontotoc.
Thank you, Mr. Chairman. Let's look at the Veterans Home Purchase Board spreadsheet here. What the Veterans Home Purchase Board does, it oversees an agency that provides loans for our veterans to buy homes after they come back from serving in the service. And there are no state dollars in this. There are no federal dollars in this. These are all self-generated by the board. The purchase board. The final action comes in at $49,318,887. That's all within the house there, Are there any questions? If not, move final passage.
Questions on the report? Gentleman from Tishomingo, Mr. Carpenter.
Thank you, Mr. Speaker. Will the gentleman yield?
Yes, sir.
You and I discussed earlier in the session, there is no cuts to this, right?
It's level funding.
Thank
sir.
you.
Exactly level funding.
I don't see any further questions. Open the machine, Madam Clerk. Question occurs on the conference report, House Bill 1725. In favor of the report, vote aye. If you're opposed, vote nay. Close the machine, Madam Clerk. By vote 118 yeas, 0 nays, report is adopted. Next item.
Thank you. Ladies and gentlemen of the House, let's go to item number 78 on the calendar. We Senate Bill 2950. Recognize the gentleman from Montgomery to explain the next several conference reports.
Gentleman from Montgomery.
Thank you, Mr. Chairman, Mr. Speaker. Ladies and gentlemen of the House, we'll go to item 2950. It's appropriations for the chiropractic examiners, the board of the chiropractic examiners, and all this conference report does is it's adopted at level funding and it removes a reverse repealer, and that's an explanation, Mr. Speaker.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2950. In favor of the report, vote aye. If you're opposed, vote nay. Everyone voted. By a vote of 100, close the machine, Madam Clerk. By a vote of 115 yeas, 3 nays, report's adopted. Next item.
Thank you. Next item, Senate Bill 2951. This is the appropriation for the Board of Dental Examiners. And the conference report is a restoration of LBR cut on the salary line of $173,113. It's additional authority for contractual legal services of $105,000 and additional authority for the board's new licensing system of $250,000 for a total increase to the LBR level of funding at $528,113. And that's an explanation, Mr. Speaker.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2951. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By vote 115 yeas and 3 nays, report's adopted. Next item.
Thank you, Mr. Speaker. Senate Bill number 2952. This is the Funeral Service Board Appropriations. And the conference report restores a vacant pen of $43,851 for a total increase to LBR of $43,851, and that's an explanation of the bill.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2952. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By vote 110 yeas and 3 nays, report's adopted. Next item.
Thank you. Next item, Senate Bill 2953, which is the appropriations for the Board of Massage Therapy. And the conferees adopted a LBR level funding, and that's an explanation of it.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2953. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Closed machine, Madam Clerk. By vote 115 yeas and 3 nays, report's adopted. Next item.
Thank you, Mr. Speaker. Next item, Senate Bill 2954, which is the Board of Pharmacy Appropriations. The conferees adopted the following changes. We restored funding to the current field pens of $31,002, and restored remaining cuts to the LBR of to the fiscal year 2020 funding level of $155,918. Update and replace a licensing system, $260,000, and added one new pen and funding for an assistant director of $196,823 for a total increase to the LBR of $643. I'm sorry, $6,430. 700. I'll get this right in a minute. Try this again. $643,743, and that's an explanation of the conference report, Mr. Speaker.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2954. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Closed machine, Madam Clerk. By vote 114 yeas and 3 nays, report's adopted. Next item.
Thank you. Next item, Senate Bill 2955, is the appropriations for the Board of Examiners of Licensed Professionals. And the conferees adopted the following changes to the LBR level. A restoration of LBR cuts in the contractual line of $6,249 for an increase to the LBR level of that same amount, $6,249, and that's an explanation of the conference report.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2955. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Closed machine, Madam Clerk. By vote 115 yeas and 3 nays, report's adopted. Next item.
Thank you. Next item, Senate Bill number 2956, is the appropriations for the Board of Veterinary Examiners. The conferees adopted the follow LBR level of funding to maintain previous sections of language and just deleted the reverse repealer. And that's an explanation of the conference report, Mr.
Questions
Speaker.
on the report? Open machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2956. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Closed machine, Madam Clerk. By vote 115 yeas and 3 nays, the report is adopted. Next item.
Thank you. Next item, Senate Bill number 2958. It's the appropriation for the Board of Architecture. And the conferees adopted the LBR level of funding. We removed the reverse repealer, and that's an explanation of the conference report, Mr. Speaker.
Questions on the report?
Move adoption.
I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2958. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By vote 115 yeas and 3 nays, report's adopted. Next item.
Thank you. Next item, Senate Bill number 2959, is the Board of Registered Geologists Professionals. And the conferees adopted the LBR level of funding and deleted the reverse repeal and maintained the previous language in the bill, and that's an explanation of the conference report.
Questions on the report? I don't see any. Open the machine,
Move
Madam
adoption.
Clerk. Question occurs on the conference report, Senate Bill 2959. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By vote 113 yeas and 5 nays, report's adopted. Next item.
Thank you. Next item is Senate Bill number 2960. This is the appropriations for the Motor Vehicle Commission. And conferees adopted the LBR level of funding and removed the reverse repealer. And that's an explanation of the conference report.
Questions on the report?
Move adoption.
Don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2960. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By vote 115 yeas and 3 nays, the report is adopted. Next item.
Thank you. The next item, Senate Bill 2961. This is the appropriations for the Board of Public Accountancy. And the conferee's adopted the following changes for funding for expert witness of $42,000. So it's a comes in as a total increase to LBR at $42,000 above LBR.
Questions on the report? Don't see any.
Move adoption.
Over the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2961. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Closed machine, Madam Clerk. By vote 115 yeas and 3 nays, report's adopted. Next item.
Thank you. Next item, Senate Bill number 2962. It's just the appropriation for the Board of Contractors. And the conferees adopted the following changes. We restored a restoration of LBR cuts to the salary line of $143,010 and deleted the reverse repealer, and that's an explanation of the appropriations for Board of Contractors.
Questions on the report?
Move adoption.
I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2962. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Closed machine, Madam Clerk. By vote 115 yeas and 3 nays, report's adopted. Next item.
Thank you. Next item, Senate Bill 2968. This is appropriation for banking, consumer finance. And the conferees adopted the following changes to LBR level of funding of $537,036. This salary to restore 4 pens and the funding for those pens, Mr. Speaker, and that's an explanation of the conference report. And
sorry, go ahead. Questions on the report?
Move adoption.
I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2968. If you favor the report, vote aye. If you're opposed, vote nay. Everyone voted. Closed machine, Madam Clerk. By vote 115 yeas and 3 nays, report's adopted. Unless I missed one, I don't see any other item remaining under the in-conference appropriations calendar. Is that correct?
Yeah, I got a general bill.
That brings us down to the in-conference appropriation general bill calendar on page 10. Item 3.
Item 3, yes, we bring up Senate Bill 2311. I recognize the gentleman from Pike to explain the conference.
Gentleman Pike, recognized to present the report.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, this is Senate Bill 2311. This is the State Board of Health extended repealer. We have voted on this bill, I believe, 3 or 4 times. We have deleted the repealer a few weeks ago. We did add a reverse repealer in case we needed this as a vehicle for the COVID money. Since then, we do not need this vehicle for that. So this is simply deleting the reverse repealer that we put in there. And again, this goes back to the bill that we voted on several times. That is the explanation, Mr. Speaker.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference report, Senate Bill 2311. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Closed machine, Madam Clerk. By vote 118 yeas, 0 nays, report is adopted. Anything further?
Appropriation yields the floor.
Thank you, Mr. Chairman. Brings us to the Ways and Means in conference calendar. Okay, we'll pass that calendar. And it brings us down to the in-conference general bill calendar. Item 3, County Affairs. Chairman's recognized.
Thank you, Mr. Speaker. We'll go to House Bill 415. It allows counties to pay every 2 weeks. We sent this to conference, and we did not have the Justice Court judges included in the original bill. They are now included so that the Justice Court judges may also be paid every 2 weeks. That's an explanation of the report.
Questions on the report? I don't see any. Open the machine, Madam Clerk. Question occurs on conference report, House Bill 415. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 117 yeas, 0 nays, report is adopted. Brings us down to item 21, transportation. Chairman's recommended.
Thank you, Mr. Speaker. Item 21, House Bill 1383 is our Economic Development Highways Act. We made a couple revisions to. The only changes that were made to the bill was we limited, for the mixed-use development, we limited the retail space to 20% of the floor space. And that's an explanation of the conference report.
Questions on the report? I don't see any.
Move
Open
adoption.
machine, Madam Clerk. Question occurs on the conference report, House Bill 1383. If you favor the report, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 115 yeas and 3 nays, report is adopted. Unless I missed one, I do not see any other report that has been filed on the general calendar. If I missed one, please bring it to my attention. Any chairman in here have another item they wish to take up? Okay, I don't see one. Brings us down to the concurrence, non-concurrence calendar. Lady from Amit.
Thank you, Mr. Speaker. I'd like to go to item number 1 on the concurrence and non-concurrence calendar. Item number 1, House Bill number 1286, and move that we do concur. This was the bill that dealt with the service of the summons in youth court shall be made pursuant to the uniform rules of the youth court practice. And the Senate changed the section that was initially in the bill dealt with 4321-501, persons on whom served. The Senate changed it to 4321-503, the form of the summon, 4321-505, the method of service. And so I move that we do concur, Mr. Speaker, and I'll yield for any questions.
Questions on the motion? Jim Alcorn, you have questions? I don't see any. Open the machine, Madam Clerk. Question occurs on the motion to concur, House Bill 1286. If you favor the motion, vote aye. If you're opposed, vote nay. Everyone voted. Has everyone voted? Closed machine, Madam Clerk. By a vote of 118 yeas, 0 nays, motion to concur passes. Next item.
Thank you, Mr. Speaker. I'd like to go to item number 2 on the concurrence, non-concurrence calendar, House Bill number 576, and move that we do invite conference. The Senate added an amendment to the bill, and I move that we do invite conference.
Any questions? I don't see any. If you favor the motion to invite conference, indicate by saying aye. Opposed, nay. The ayes have it.
Thank you.
Lady, use the floor. Jim Alcorn, Mr. Bain. Hang on, gentlemen. Try it now.
Okay, thank you, Mr. Speaker. On concurrence and non-concurrence, item 3, House Bill 1559, I would ask that we invite conference.
Any questions? I don't see any. If you favor the motion, indicate by saying aye. Opposed, nay. The ayes have it. Next item, Jim from Marshall.
Thank you, Mr. Speaker. House Bill 1095, I move that the House not concur but invite conference.
Any questions? I don't see any. If you favor the motion, indicate by saying aye. Opposed, nay. The ayes have it. Motion passes. Brings us down to the Ways and Means calendar. Passes. Brings us down to the general calendar. Passes. Brings us down to local and private calendar. Chairman recognized.
Thank you, Mr. Speaker. I'd like to go to item number 1 on the local and private list. Call up Senate Bill 2906. Make the usual motion.
Gentleman calls the bill up, moves that the rules be suspended. Bill considered in gross red the third time placed on final passage. All in favor say aye. Opposed, nay. The ayes have it. Gentleman's recognized.
Thank you, Mr. Speaker. This Senate Bill 2906 is for the supervisors of Warren County. This is a list of contributions that they would like to give. $6,700 to the Sharkey Community Action, Mountain of Faith, $4,500, We Care Community Services, $5,600, Vicksburg Family Development Services, $4,500, Triumph Ministries, $11,250, Central Mississippi Prevention Services, $1,125. This is a one-time contribution. In fact, the repeal date is actually October of this year. And that's an explanation of the bill.
Questions on the bill? Excuse me, gentlemen, I'm not sure we even called that bill up, did we?
Thought we did.
Did we? Okay. I was busy talking.
Well.
All right. Questions? I don't see any. Open the machine, Madam Clerk. Question occurs on the conference, on the Senate Bill 2906. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By vote 115 yeas and 2 nays, bill passes. Next item.
Thank you, Mr. Speaker. I'd like to go to item number 2, Senate Bill 2982. Call it up, make the usual motion.
Gentleman calls the bill up, moves the rules be suspended. Bill considered in gross red the third time placed on final passage. All in favor say aye. Opposed, nay. The ayes have it. Gentleman's recognized.
Thank you, Mr. Speaker. This is authorizes the Board of Supervisors of Marshall County to expend from the county funds. These are matching funds for federal programs. This is, many of you know, if you've got a Head Start program in your community, it requires a local match of some kind. In this particular situation, it would allow Warren County to spend up to, but not more than, $50,000 to match their federal money on the Head Start program and $150,000 on the Northeast Mississippi Community Services. You may remember we had a bill the other day that had 7 or 8 counties in it for this same Northeast Mississippi Community Services. Marshall County is a part of that coalition. They chose this year to come with a separate bill, and so we removed them out of the bill that covered all the rest of the counties up there the other day. This particular bill has a 3-year repealer in it, and that's an explanation of the bill.
Questions on the bill? I don't see any. Open the machine, Madam Clerk. Question occurs on Senate Bill 2982. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By vote 113 yeas and 4 nays, the bill passes. Next item.
Thank you, Mr. Speaker. I'd like to go to item number 3, call up Senate Bill 2983. Make the usual motion.
Gentleman calls the bill up, moves that the rules be suspended. Bill considered in gross red the third time placed on final passage. All in favor say aye. Opposed, nay. The ayes have it. Gentleman's recognized.
Thank you, Mr. Speaker. Senate Bill 2983 would allow the supervisors of Coahoma County to contribute $15,000. This basically is a 1-year. It'd be a single payment. It's actually just got a 1-year repealer in it to a group called But God Ministries. Did a little research on this. This group has been very active in Coahoma County, active in schools and other things. And this particular project that they're interested in helping with, the supervisors are interested in being a part of, is actually an economic development project that they are doing for the county, and it's actually a business incubator. So this is something that'd be really good for the community. Young entrepreneurs could go there, understand about how to get started in business and so forth. And that's and what the county is trying to do here is just be a part of that effort. They're contributing $15,000 to that, and eventually the people in Coahoma County will benefit from this. So that's an explanation of the bill.
Questions on the bill? I don't see any. Open the machine, Madam Clerk. Question occurs on Senate Bill 2983. If you favor the bill, vote aye. If you're opposed, vote nay. Everyone voted. Close the machine, Madam Clerk. By a vote of 114 yeas and 4 nays, the bill passes. Next item.
Thank you, Mr. Speaker. I'd like to go to item number 4, call up Senate Bill 2984. Make the usual motion.
Gentleman calls the bill up, moves that the rules be suspended, bill considered and gross read the third time, placed on final passage. All in favor say aye. Opposed, nay. The ayes have it. The gentleman's recognized.
Thank you, Mr. Speaker. Senate Bill 2984 would allow Marshall County to contribute. It's a 3-year repealer, so for the next 3 years, we'd be able to contribute in any single year an aggregate not to exceed $7,500 to, let's see, 1, 2, 3, 4, 5, 6, to 6 different food pantries that are located in Marshall County. We're very specific about what the money would be used for. The Senate actually did a committee sub to clarify that the money would be used for these food pantries. In today's climate and environment, this was something they wanted to do. And like I say, that it's $7,500, but that's an aggregate number. So they can't contribute more than that, but they can contribute up to that $7,500 in different increments to these various food pantries in Marshall County. That's an explanation of the bill.
Questions on the bill? I don't see any. Open the machine, Madam Clerk. Question occurs on Senate Bill 2984. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 114 yeas and 4 nays, the bill passes. Next item.
Thank you, Mr. Speaker. I'd like to go to item number 5, call up Senate Bill 3010. Make the usual motion.
The gentleman calls the bill up, moves the rules be suspended. Bill considered and gross read the third time, placed on final passage. All in favor say aye. Opposed, nay. The ayes have it. The gentleman's recognized.
Thank you, Mr. Speaker. Senate Bill 3010 is a bill for Tunica County. This has actually been in place since 2004. It's been repealed. The repealer has been extended a number of times, but it allows the Board of Supervisors of Tunica County, in its discretion, from available funds to provide funding for the Tunica County Economic Development Foundation in an amount not to exceed $10 million. Now, I don't know what they give in terms of on an annual basis, but this is probably a high number of what they can't exceed. And so, but this is the number that's been there for many years. All we're really doing here is just extending the repealer for 4 years on a program that already exists, or a authorization that already exists.
Questions on the bill? I don't see any. Open the machine, Madam Clerk. Question occurs on Senate Bill 3010. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Close the machine, Madam Clerk. By a vote of 114 yeas and 4 nays, the bill passes. Next item.
Thank you, Mr. Speaker. I'd like to go to item number 6. Call up Senate Bill 3036. Make the usual motion.
Gentleman calls the bill up, moves that the rules be suspended. Bill considered and gross read the third time, placed on final passage. All in favor say aye. Opposed, nay. The ayes have it. Gentleman's recognized.
Thank you, Mr. Speaker. Senate Bill 3036, we had a very similar bill to this come before us a few days ago from the city of Vicksburg. This is motor-assisted scooters, and what we're doing is authorizing the city of Jackson basically to have some ordinances and so forth. We have put a 4-year repealer in it, as I said the other day with the Vicksburg bill, so we can come back a year or two from now. This is a new type of request. These are rental things for the most part. These scooters are literally considered a bicycle for purposes of ordinances. They don't require a driver's license, but you do have to be old enough to drive. So there is some consideration here. I think we probably need to do this. We've got cities across the country that are doing this routinely now, and so these 2 cities have come this year and asked us for that same thing. But this is for the city of Jackson, and that is an explanation of the bill.
Questions on the bill?
I
don't see any. Open the machine, Madam Clerk. Question occurs on Senate Bill 3036. You favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Close machine, Madam Clerk. By a vote of 116 yeas and 2 nays, the bill passes. Next item.
Local and private yields floor.
All right. That brings us to the House supplement calendar. Ladies and gentlemen, you should have on your desk. Rules has 2 items to take up. Oh, I'm informed it's not on your desk, that it is online. The calendar. Do you need to read the committee reports? I'm going to recognize Madam Clerk to read the committee report.
Report of Committee on Rules, House Bill 1783, the Mississippi Back to Business Liability Assurance Act, create, title sufficient, do pass. House Bill 1779, Healthcare Emergency Response Liability Protection Act, create, title sufficient, do pass.
Chairman's recognized.
Thank you, Mr. Speaker. I'd like to go to the supplementary calendar on rules. Item number 2, House Bill 1779. Call that up and ask the gentleman from Pike to explain the bill.
Okay, we probably need to make the usual motions, gentlemen.
Make the usual motion.
Chairman calls the bill up, moves the rules be suspended. Bill considered and gross read the 3rd time, placed on final passage. All in favor say aye. Opposed, nay. Ayes have it. Gentleman's recognized.
I'd like to yield to the gentleman from Pike to explain the bill.
Gentleman from Pike.
Thank you, Mr. Speaker. Thank you, Mr. Chairman, ladies and gentlemen of the House. This is the House Bill 1779, which is an act to create the Healthcare Emergency Response Liability Protection Act. I'll go through it very briefly. Section 1, of course, names the act. Section 2 actually defines what a healthcare facility is, a healthcare profession. Talks about the state of emergency when this act will go into place. Talks about the Presidential Declaration of Emergency. It's also defined in here. Section 3 is key. Real quickly, Mr. Speaker, it says any healthcare professional or healthcare facility shall be immune from suit for any injury or death directly or indirectly sustained because of the Healthcare Professionals or Healthcare Facilities Acts while providing healthcare services related to a state of emergency. So as we know, ladies and gentlemen of the House, all of our healthcare facilities, whether it's been nursing homes, whether it's been hospitals, they have stepped up. All of our healthcare professionals, whether it's home health agencies, healthcare professionals, hospice employees, they've all stepped up and they're going to work. I remember, Mr. Speaker, that after this pandemic was announced, we had a Sunday school member. She's a hospice worker, home health worker, and couldn't find masks and had to go to people's homes and with just something she made. And so they have all stepped up. And so this provides a little bit of protection to our healthcare professionals, our healthcare facilities. Many other states have done this. And so that is the explanation of this bill, Mr. Speaker.
Questions on the bill. Gentleman from Washington, Mr. Hines.
Thank you, Mr. Speaker. Gentleman Yield.
Yes, sir.
Gentlemen, don't we already have tort reform in place?
We do, gentlemen, but this is just an added protection.
So isn't it already liability protection in place for healthcare facilities that are county-owned and all that kind of stuff? And that stuff, isn't it already in place?
Well, yes, sir, for a healthcare facility, but this goes a step further by protecting your healthcare workers. And so I think that's really where, yes, your tort reform is protecting your hospitals and your nursing homes. But to my example of the home health worker that's going into someone's home to provide that service, this is going to give that employee, that person, a little added protection, gentlemen.
No, gentlemen. You would agree with me, it's not going to give that person, it's going to give the person that owns that business some protection. So let's not skew the facts a little bit now. So here's the other piece of that. Has there been any lawsuits filed or have there been any complaints filed saying that this is a problem? Is there a data-driven history saying that this is a problem?
Well, gentlemen, I would say that obviously this started in the middle of March when we left, March 16th or 17th, and so I think the employees are out there still working. I think that's still to be known what's going to happen down the road. And so I think this is just being very proactive and saying, we're going to take care of the ones who are out there protecting our citizens. And as you do, and I do speak to many healthcare workers throughout the days and since March the 15th and 16th, And how many times have we gone through neighborhoods and seen these signs that said that these healthcare workers are heroes? And so I thank them for what they're doing. And so this is just a little bit of added protection for our healthcare facilities and our healthcare professionals. And I think they deserve it, gentlemen.
So gentlemen, workman's comp does not cover these workers. That's what you're telling us. That these entities that own business have no workman's comp. Is that what you're telling us?
Well, John, I'm not telling you that. I'm telling you that this goes a little extra step for our healthcare professionals that's needed, and I don't know why we wouldn't say yes. Thank you for what you're doing for our citizens.
So, are we going to do this for school teachers?
Well, today,
are we going to do this for school teachers who are in a situation?
Well,
just the other day, they had a school coach tested positive, and 14 players got caught up. So, are we doing this for everybody, or just because a few folk gave some contribution to a few people who own nursing homes, they're going to get some protection? That's what we're doing now?
Well, today we're looking at healthcare professionals and healthcare facilities, and down the road we may look at other aspects that we need to. But today we're here to say thank you for the healthcare facilities, thank you to our healthcare workers, and this will give them a little added protection, gentlemen.
So gentlemen, what is the base coverage amount that nursing homes have to have in regard for worker comp coverage? Do you know?
I don't know, Jim. I can get that information for you. But again, this is not going to me, this is not a workman's comp bill. This is strictly just taking care of our healthcare facilities.
Well, gentlemen, would you not agree with me that if you employ a certain number of people, you have to have workman's comp coverage? Would you not agree with me?
Jim, if you say that's correct, but again,
okay,
I would argue this is not dealing with the workman's comp issue. This is dealing with our healthcare facilities, our healthcare professionals
gentlemen,
during a pandemic.
Let me ask you a question.
Yes, sir.
When you're at work, sitting behind your desk, you get up, walk out of your office, and slip and fall on the floor and hurt yourself, are you covered by your workman's comp coverage, yes or no?
I would think that type of employee would be covered, correct.
Okay, so if I'm a lab tech, gentlemen, would you not agree with me that if I'm a lab tech and I poke my finger while I'm drawing somebody's blood, will my workman's comp coverage cover me, yes or no?
Well, gentlemen, this legislation here, I'm answering the question, gentlemen, this legislation is here in front of us to protect our healthcare professionals, our healthcare facilities, give them an added protection during a pandemic. This is not during a normal course of action. The legislation clearly states that it's defined when there's a state of emergency, when the president declaration, and so it's clearly defined during a national emergency, which this is.
I'm glad you said that, gentlemen. Now that you've opened that door, does this piece of legislation only cover the time certain of the pandemic?
Yes, sir, and actually it will end 90 days after the end of the state of emergency on line 53.
So it ends in 90 days?
Yes, sir, 90 days after the end of the state of emergency.
So are we using a crystal ball now to say that there's going to be has somebody said they're going to sue or something like that? I'm just a little confused. I want you to help me because you have been a great chairman, and I just want to make sure that we have some clarity, because where there's clarity, there's understanding. Where there's understanding, there's peace and discord.
Right. So there is a starting date on this type of particular legislation when it's a state of emergency, and there is an ending once that state of emergency is over.
Okay. Thank you, Jim.
Yes, sir.
Lady from Hines, Ms. Yates.
Mr. Speaker, I have an amendment at the proper time.
Okay. Gentleman from Hines, Mr. Dortch.
Thank you, Mr. Speaker. Gentlemen, you?
Yes, sir.
I had a question. Does this apply to, say you're a healthcare worker at a healthcare facility, does this make this prevent a healthcare worker who becomes sick because of the omission of the provider from being able to bring suit?
Okay, state your question again, gentlemen.
So say you're working, an OT working at a nursing home, and the nursing home does not provide the gear that they need, the PPE that they need, even if they have it, or take the proper precautions. I believe in here it says omissions. Would that occupational therapist be able to bring a suit against the nursing home if they commit negligence and don't do what they're required to do?
Well, it's clear, gentlemen, and you are an esteemed attorney, but lines 45 through 54 will speak to that. And it's clearly any healthcare professional or healthcare facility shall be immune from suit for any injury or death if that person is obviously providing healthcare services related to a state of emergency. So, again, the state of emergency has to be defined. And so I would say that it would protect both the healthcare worker, healthcare professional, and the healthcare facility.
And gentlemen, I understand what you're trying to do with the bill, and I appreciate what healthcare workers have been doing. My wife's an OT who's been going to nursing homes since this started. My concern is knowing, and I'm sure you know as well, that some of these nursing homes have not been doing what they needed to do, and they haven't protected their workers, much less their clients or patients, however you want to describe them. I think we may be a little too broad in this, and maybe something we could look at going forward.
Thank you, gentlemen.
Jim from Hines, Mr. Bell.
Thank you, Mr. Speaker. Gentleman, you here?
Yes, sir.
And I think the gentleman from Hines may have answered my question, but I want to make it a little clearer. So my mother is a nurse, and she works at a hospital, and she comes in contact or may come in contact with COVID patients. So if she is infected and files suit, you're telling me that she would not be eligible under this piece of legislation on those lines that you stated? And hey, Mom, I know you're watching.
That's the way I'm reading it, gentlemen. I mean, I think the hospital, the healthcare facility is doing everything they can to obviously have a safe environment for the employees and the patient, and the same thing with the healthcare professional. And so, obviously, as you know, if the healthcare worker is doing everything that person can to take care of that patient in a unique situation, then this will protect the healthcare worker for whatever reason. If that patient comes back and says, "You caused me to become sick," well, there's a protection for that healthcare worker.
Oh, okay. So is there any protection in there for the healthcare worker who has become sick as is there any protection in this piece of legislation that will protect the healthcare worker in the event that the hospital or nursing home did not do their due diligence in cleaning the facilities?
Not to my understanding, Jim. Line 45 through 54 clearly states that the protection is for the healthcare worker, which would be your mom and the gentleman's wife, and also for the facility.
All right, thank you.
Thank you.
You got something in the clean?
Jim from Smith, Mr. Tullis.
Will the gentleman yield?
Yes, sir.
I've got just a couple of questions to kind of piggyback off what the prior gentleman said. In the state of Mississippi, the exclusive remedy for any employee is workers' comp. So if Mr. Bell's mother is a nurse and she gets COVID while working, does this bill prevent her under the exclusive remedy from filing a workers' comp claim?
No effect, gentlemen.
Has no effect, so it doesn't affect workers' comp. Can you give me an example of any time in the state of Mississippi where we have passed legislation to give complete immunity to an entity like hospitals, healthcare workers, during the SARS crisis or anything of that nature? Because that's what this bill is doing. It's giving them complete immunity with tort reform as well as this bill here.
Well, gentlemen, I'm not an attorney, but I can assure you that the last month since March 15th, I think we've all understand that this is completely different than the SARS that you talk about or the other type of flus, and so we're in a different time. And so we are treating this situation completely different than we have when we have a bad flu or we have something that is the SARS. And so I think you've got this is clearly defined as a presidential declaration, a state of emergency. And so I think comparing those two in this type of situation, type of environment is just simply not true.
And I understand that, and I can appreciate that. But my question is, hospitals, healthcare workers have received federal funds. If somebody is diagnosed and they have to be hospitalized, if they have Medicare, Medicaid, private insurance, it's paid. So why are we giving these entities immunity when they've been paid for the medical treatment? And yet, if I'm sorry.
No, Jim, I guess I don't agree with that. I mean, my Sunday school member who works in the healthcare field has not got federal money. And so she is a nurse going out in people's homes taking care of patients. So if she gets that patient sick for whatever reason, this is going to give her some liability only during this pandemic. So I would just disagree. She's not received all this federal money, gentlemen.
But her employer has.
Well, she hasn't.
But she has continued to work. So her employers received federal dollars, receiving state dollars. And so this employee who goes out to, and does it include any willful or gross misconduct on the part of the employee?
Yes, sir. It does. Line 85 talks to that if they're still done something that's obviously warrants a lawsuit, then that still can happen.
Okay. All right. Thank you.
Jim from Forest, Mr. Watson.
Yes, Mr. Speaker, if the chairman would yield.
Yes, sir.
Now, I just talked to a nursing facility here in Mississippi, and this facility indicated that they would encourage all or require all employees to wear facial masks until the end of this year. If this bill passes and this facility, the personnel of this facility just refuse to ever wear facial masks, and the failure to wear facial masks actually contribute to an epidemic within that facility, you are telling me that this bill will grant that facility immunity?
No, sir. Based on, and again, I'm not going to speak to hypotheticals. However, if you have a facility and that facility is privately or publicly owned, and that facility is telling their employees that they must follow a certain CDC guidelines or their own guidelines, and that employee must wear a mask, and that employee does not wear a mask, then that employee is not following the direction, and I would think that employer has the ability to terminate that employee.
Oh, my question doesn't pertain to termination. It pertains to the quality of care. My concern is that this bill could encourage non-compliance with the CDC protocol. Would it not?
No, sir. I mean, I don't get a sense at all by reading the bill that that's what it's indicating. This is simply, it goes back to lines 45 through 55. It's just simply, once you define the healthcare facilities and healthcare professionals, you were giving them some protection during this pandemic. And again, it would not be a similar situation where you have an outbreak of flu. I mean, this is an issue that none of us have been through, gentlemen.
But would you say under this bill it says reckless, and I believe it says intentional would be the level of conduct. But if an individual under the hypothetical that I presented to you just said, well, I'm just not going to wear gloves, I'm not going to wear a facial mask, I'm not going to wash my hands, and I'm just not going to follow the CDC guideline, this bill would in fact give that facility protection, would it not?
I disagree, Jim, and you're hypothetical again. I would expect that employee to be terminated.
Well, again, I'm not talking about the termination of the employee. I'm talking about the liability of the facility to the person receiving professional care. I mean, who are we trying to help here?
Well, gentlemen, we can go back to starting the definitions of Section 2. It talks about which ones are getting the immunity: healthcare facilities, healthcare professionals.
So we are not trying to improve or enhance the quality of care. Are we trying to do that by passing this bill?
Well, gentlemen, I would think you're going to have, I would argue, gentlemen, for the last, since March the 15th or 17th, since we left here and our lives have been turned upside down, that the healthcare workers that are our neighbors, when we were quarantined back home, our neighbors were getting up going to work, and they were going to nursing homes, they were going to hospitals, they were working for home health and hospice companies. So this is going to protect them. This is for them to say thank you during this pandemic. This is not during a normal winter. This is during a national pandemic that we're going through today.
Well, I know that your intent may be good, Mr. Chairman, but my question, and this last question is rhetorical, and that is, are we trying to improve the quality of care, or are we just trying to, in the end, reduce the quality of care?
No, sir, I think we will improve quality care. Thank you, Mr. Speaker. I yield.
All right, lady from Hines indicates she has an amendment. Ladies recognized to present her amendment.
This amendment simply adds one sentence that says that nothing in this bill affects the application of workers' compensation law. We heard both the chairman state that this bill was to protect the healthcare workers that we are all grateful for, and he specifically said that it is not meant to affect or impact workers' compensation law. So this one sentence specifically just clarifies that and makes it clear.
Questions? I don't, there is one question. You yield for, she'll be allowed to close. I'll recognize the chairman to respond.
Nothing in this section affects workers' compensation law, including the exclusive application of such law. It's in the other bill, but it's not in this one.
Thank you, Mr. Speaker. Obviously, this legislation was filed yesterday, and this is the first that we have seen the amendment. And so I've spoke to the chamber, and this does not affect the business workman's comp. It's clear what the intent of this legislation is. And so as we go through the process, we will continue to look at this. And again, this is the first we've seen the amendment, and so we would definitely need time to look at it clearly. So I'm asking today, since we are not sure about the amendment, I'm going to ask you to oppose the lady's amendment.
Recognize the lady to close.
This is the first time that the amendment was seen by anyone because we just saw this bill for the first time today. I had no other opportunity to make this amendment or get approval for this amendment. But the amendment specifically says that nothing in this bill will be affected, will affect workers' compensation law. That is the intent that we were told by the chairman and the others when they were up here explaining this bill. If our goal is to protect healthcare workers, then that's what we need to make sure that we're doing.
All right, I don't see any questions. Question now recurs on Amendment 1. If you favor the amendment, indicate by saying aye. Aye. Opposed, no. The noes have it. The noes have it. Roll call is demanded. There is sufficient number. Open the machine, Madam Clerk. If you favor the amendment, vote aye. If you're opposed, vote nay. If you favor the amendment, vote aye. If you're opposed, vote nay. Has everyone voted? Has everyone voted? Close the machine, Madam Clerk. By a vote of 55 yeas and 62 nays, the amendment fails.
Move final passage.
All right. Any questions? Anybody wish to speak? Anybody wish to speak on the bill? Okay, I don't see anybody. Do you wish to speak, gentleman from Marion?
No, sir.
I would request that me and my desk mate be recorded as not voting. I was not paying attention to the board being lit up as a yay. I want to be not voting, period.
On what, gentlemen? The amendment we just voted on, or this?
Right.
The amendment. Okay. On the previous amendment, were you not voted?
According to the board, it said on the yay.
Yes,
so
sir.
we just voted on it.
Right.
I wasn't going to vote because my wife's in the hospital administration, so I'm not voting.
Okay.
One way or the
So
other.
you were voted as yay. You want to be a no vote.
That's right.
You and
no, I don't want to be voting. I just not voting. Period.
I mean, that's what I meant. A non-vote is what I meant to say. You and the gentleman from Tate.
Thank you. Yes, sir.
Any objection? Change the gentleman's vote. All right. I don't see anyone wishing to speak on the bill. Open the machine, Madam Clerk. Question occurs on House Bill 1779. You favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Has everyone voted? Closed machine, Madam Clerk. By order 75 yeas, 43 nays, the bill passes. Lady from Pearl River, Ms. Wilkes, what purpose you seek recognition?
Thank you, Mr. Speaker. I mistakenly voted. My seatmate a yes on that amendment, and he is a no.
Okay.
Permission to correct.
Any objection? Change the gentleman.
Thank you.
Change the vote. Okay, ladies and gentlemen, let me just remind everyone, because of the COVID situation, and we do have members who are not in the chamber, everyone will be voted yes. And if you wish to vote no, you need to take some affirmative action to record a no vote, either by punching the machine for those of you who are in the chamber, and for those of you who are not in the chamber, you need to come in here and notify or text the clerk. All right, next item.
Mr. Speaker, I'd like to go to item number 1, House Bill 1783. Call that up and make the usual motion.
The gentleman calls the bill up, moves that the rules be suspended. Bill considered and gross read the third time, placed on final passage. All in favor say aye. Opposed, nay. Ayes have it. Gentleman's recognized.
The gentleman from Jackson will explain the bill.
The gentleman from Jackson is recognized.
Thank you, Mr. Speaker, Mr. Chairman, ladies and gentlemen of the House. 1783, also known as the Back to Business Liability Assurance Act, is similar in concept to the previous bill, but let me see if I can do a little bit better job in terms of the legal explanation. The definitions of the bill are pretty simple. You can read those for yourself. We're dealing with, in Section 3, we're dealing not with hospitals and medical providers, but with business owners and individuals. And in Section 4, we're dealing with manufacturers of products. So we're not dealing with the medical big picture. We're dealing with business owners and products liability in this case. I want to make something very clear. We're not providing complete immunity, gentlemen. What we're doing is raising the standard of care in these cases. These people will still be liable if you can prove that the damages were caused by a twofold test. If those damages were clear and convincing as a result of actual malice, willful, or intentional conduct. So we're providing immunity with those exceptions. If you can show, if the plaintiff or the damaged party can show that those damages were caused by actual malice, willful, and intentional by clear and convincing evidence, you will have liability. Now, secondly, I want to point out that in this bill, we do have specific language that it does not affect, lady from Hines, any type of workers' compensation case. We are limiting the scope in both time and liability for this immunity. The time period is specifically limited to the duration of the governor's call for a declaration of emergency in Mississippi. And that's pretty much the general explanation of the bill. And Mr. Speaker, I'll be happy to take any questions.
Questions? Gentleman from Hines, Mr. Dortch.
Thank you, Mr. Speaker. Gentleman, yield.
Yes, sir.
Am I wrong to look at that language you cited and understand it to say that a business has to intentionally give someone COVID to be liable?
No, the damage has to be shown. What it says is that the damages has to be shown by clear and convincing evidence to be the result of intentional conduct.
So there has to be clear and convincing evidence as a restaurant owner that I was trying to give someone COVID for them to be held liable in any way.
Well, I mean, not just intentional, but willful or actual malice.
Those are different definitions of the word intentional, gentlemen.
No, it's not exactly, but...
So you're saying it's even more than being intentional. You actually... So, gentlemen, if right now we have 50% capacity for our restaurants, and if we have a restaurant that says we want to have 100%, we want to pack the place, they can do that every night knowing that they have an outbreak going on in that restaurant. They're not liable for anything under this bill.
No, gentlemen, there's got to be a good faith effort to follow the CDC guidelines in this case.
But it also has to be clear and convincing evidence that they acted intentionally with malice to give someone COVID. As long as they didn't have any intention of giving someone the disease, which I can't understand how you could prove someone was trying to give somebody COVID unless you just went and coughed on somebody.
No, gentlemen.
This is basically, there's no reason for a restaurant or any business to do anything to protect the people that are coming to their business.
No, that's not true at all, gentlemen. That's a misinterpretation of the bill. What we're trying to do is business owners and product manufacturers, if there is a good faith effort, okay, and if there is no actual knowledge or intent to harm somebody, that business owner and that manufacturer of that product will have immunity. So that's what we're trying. But hold on, gentlemen. Just one other thing. And concerning your hypothetical about the restaurant with the 50% capacity, if you've got an owner, okay, who knows what those guidelines are, okay, 50% is in place, he or she intentionally packs that place with 100% capacity, I think that would make the threshold of the standard of proof that we have, gentlemen.
Gentlemen, you're saying that you're going to argue that they were intentionally giving somebody COVID because they disobeyed the rules on capacity, which aren't even, they're basically suggestions right now.
Well,
you're really standing up here trying to body that.
I'm not saying that they're causing some other person to have COVID. I am saying what I'm trying to tell you gentlemen this morning is that if you have the CDC guideline of 50% in place for a restaurant, okay, and that owner knows, everyone knows what those CDC guidelines. If there is actual malice, specific intent to avoid that 50% capacity limit and to pack his or her place with 100% capacity, I think you're looking at some type of liability, gentlemen.
So you're saying
is what I'm saying.
You're saying that rule applies to them not intentionally trying to give someone COVID, but how they interpret or allow people into their restaurant or businesses.
I mean, I'm not sure I'm following your question again.
What you just described. Ask it again.
Gentlemen, what you're describing is not a good faith effort to follow the guidelines. If you've got somebody who is trying to pack his or her place 100%, I'll say it one more time, to 100% capacity, and you've got the CDC guidelines and you've got the recommendations by the governor saying 50%, I think that person is going to have some type of liability.
It says here on line 73, failure to comply with public health guidance alone shall not be sufficient. You have to intention under your bill. And gentlemen, I don't know why, I mean, this is obviously the intent of the bill is to give people immunity. I don't understand why you can't simply say that we're trying to make sure no business can be sued for anything in this state under COVID.
The intent. Okay.
Well, ladies and gentlemen, if I could have your attention, please. I've just been informed that the United States Senate has confirmed the appointment of our former member, Corey Wilson, to the federal bench. So. Congratulations. All right, next question. Gentleman from Hines, Mr. Bell.
Thank you, Mr. Speaker. Gentlemen, you yield.
Yes, sir.
Following along the lines of my colleague from Hines. I missed some of the debate, back and forth conversation. So I heard you say, or he say, that there was a situation, or there could be a situation where you have a restaurant or a business that's packed with individuals, and under this bill, you're saying that we would have to find, or anybody that's trying to sue this business would have to find that the business, essentially violated the standards and guidelines of CDC in order to be sued. Am I correct on that?
By clear and convincing evidence and showing intentional misconduct.
Okay, so how can you basically find that? How can you find that in law? How can you find in someone intentionally if you're saying that they're following the guidelines? If that makes sense.
If there's a good faith to follow the guidelines, I mean, right. Well, the definition of intentional, I mean, that person, for example, that business owner would have to, know what those guidelines are, specifically, let's just say 50% in your example. And he lets in 100%, of the people to fill that place up to capacity, intentionally knowing that was, against the guidelines. I think you're looking at some possible liability.
Okay, and then under line 73, which was a question that I had, but my colleague already asked it, but it says, alone shall not be sufficient.
Yeah, that's coupled with standard of proof. You got to show that, again, you got to show that violation by clear and convincing evidence with, intentional conduct. I mean, that's the standard of proof.
All right. Thank you, Jim.
Sure.
Jim from Mike Tibbehall, Mr. Taylor.
Thank you, Mr. Speaker. Gentlemen, will you yield?
Yes, sir.
I don't rise too often to ask questions, but this particular piece of legislation does bring me some concern. The willful and malice part is really throwing me for a loop. I looked up the definition of malice, and it says vicious, malicious, spiteful. So you're telling me that nothing short of taking a vial of COVID-19 and placing it into a syringe and injecting somebody while holding them down will disqualify this business from lawsuit?
No, gentlemen, that's a very, very extreme hypothetical.
It is.
It
is a very extreme hypothetical.
And that's not what we're discussing here. What we're discussing, we're not talking about complete immunity. We're talking about raising the standard of care concerning business owners and products liability cases where if the defendant or the business owner, that manufacturer, has the intent and the actual knowledge and malice to not follow the guidelines, to not do the right thing, then he or she will be facing, I think, in my opinion, some type of liability.
Gentlemen, who does this bill protect? Does it protect the employee of the business?
Well, I guess, gentlemen, that's, again, I guess in a way you can, because it excludes the Workers' Compensation Act altogether. So in a way, it does protect the employees.
Now, you liken this bill to the previous bill, which gave protection for the business provider, the business owner, and the employee.
Well, no, this is the business owners. The previous bill was concerning medical providers.
Okay. So my question is, if there is equal protection for the consumer and the business, make a long story short, I'll be very hesitant to have one attorney represent me as a customer and the business.
Well, unless you have me as an attorney, gentlemen.
I yield the floor, gentlemen.
Jim from Smith, Mr. Tullis.
Will the gentleman yield?
Yes, sir.
Gentlemen, once again, I can appreciate what y'all are doing and what y'all are attempting to do. But I do have a couple of questions. why are we changing the burden from preponderance of evidence to clear and convincing evidence? What is the purpose of that?
Because in these type of cases, gentlemen, you have a national pandemic, it's statewide, and the causation could get out of hand. And you understand that as an attorney. I mean, someone can make an allegation that I got this virus from anywhere and at any time, at any place, gentlemen. And if you let that go on and on and on, the court systems, businesses, everything would come to an absolute standstill. Am I right? And you know that. So if you let that causation issue expand, that's what would happen.
So we're going to increase the standard to just below a criminal standard beyond a reasonable doubt, to clear and convincing. And can you give me an example under this statute where a business owner would be held liable?
Well, I mean, I can give, yes, again, gentlemen, I can give you an example. I can give you an example under the products liability section too. Let's just say, ladies and gentlemen, you have a manufacturer of a mask, a protective mask, okay? Protective device. And that manufacturer knows through studies, through samples, through testing, that mask is not up to par in protecting the public, in stopping the spreading of the virus, so on and so forth. And he or she decides, because of the compensation involved, that they're going to go forward with that manufacturing of that mask. I think you're facing some liability. If you've got that actual knowledge and intent, and he or she goes forward, I think that person is facing some liability. So that would be a very good example under the products liability picture.
Yeah, but that doesn't meet the standard. I mean, that doesn't. I think
that would.
Well, you might think it does under that bill, but it doesn't. And you know that a judge is not going to find that I've met my standard of proof by clear and convincing evidence of willful and actual malice, because how do I prove as a injured party? How do I prove that? Because I'm not going to be able to prove that.
I'm sure you have tried products liability cases. You prove it by showing, just like the example I cited to you, that person, that business owner, had actual knowledge that the device did not meet the standards, that the manufacturing process was incorrect, was up to par, that device did not, stop the spread of the virus or slow down the spread of the virus. You can cite the same example for maybe the manufacturing of hand sanitizing lotion. If they're trying to cut cut back on expenses and save money, instead of putting in the right chemicals, they have actual knowledge during the manufacturing process that those chemicals are not getting put in to the final product, to stop the virus, then I think you're looking at liability in that case too.
Right, but the standard's not actual knowledge, it's actual malice. It doesn't matter if he had actual knowledge.
But gentlemen, you're leaving out the willful and the intentional. If you can, that's willful and pretty intentional if they leave out certain chemicals that makes that sanitizing product defective.
And that gets back to, so why, if we have to have such a high standard of proving actual malice and actual intent, then why are we raising the standard to clear and convincing evidence? Because we're having to prove some intent or malice, and then not only are we having to prove that, we're having to come back and prove just less than a criminal standard, clear and convincing evidence.
But those two examples that I cited to you, gentlemen, where you have actual knowledge, and if you can, sometimes you can prove that pretty easily. It would meet that standard. But the reason, look, you're dealing with a causation issue in these cases. I mean, a plaintiff, one of your clients can say, hey, I got this virus from, business owner X, Y, and Z. And how do you prove causation? I mean,
you would have to prove causation by asking a medical doctor, somebody that's qualified, do you have an opinion based upon a reasonable degree of medical probability? That's how you do it in every single case. One last question. Why are we decreasing the statute of limitations from 3 years to 2 years?
The statute, well, it's technically you're not decreasing at all because there is no statute of limitations to begin with specifically dealing with these types of cases.
Well,
I mean, this is a new, but it's because you don't know, what we're looking at is hopefully the time period is going to be during the declared statement by the governor of the state emergency, okay? There is no extension after that. Once that declaration is over, then this immunity does not apply. But you got 2 years, it's a 2-year statute of limitations because we feel like that would be a reasonable time period in which to be able to, gather the evidence, prove your case, get everything in place to proceed with one of these cases, gentlemen.
Okay, thank you.
Sure.
Jim from Home, Mr. Clark.
Thank you, Mr. Speaker. Would the gentleman yield?
Always.
Jim, I got a lot of heartburn about this bill. I let the other one slide, but this one is pretty bad. You're a learned attorney. I know you are. Let's go back and talk about this burden of proof. You have clear and convincing, preponderance of the evidence. This is actually the highest burden of proof that the plaintiff will have to walk in court and do. Is that correct?
Well, it's not the highest burden. No, that's. But we're increasing the. It's not higher than any type of criminal standard of proof. But
civil. It's the highest possible civil burden of proof.
Well, I guess you can probably implement a criminal standard in civil cases, but I mean that's not what we have on the codes. But anyways, it's high.
It's high. Right now, as far as business liability, it's preponderance of the evidence. More likely than not. Correct?
Correct.
Now, gentlemen, let's go back and let's talk about this line 68.
I'm sorry, which line?
Line 68.
68.
At the end of the day, this bill boils down to actual malice or willful or intentional misconduct. You have people who go to jail for those 4 things. Is that correct, gentlemen? In some instances.
No, the criminal standard is higher.
No. Actual malice, willful, or intentional misconduct is what you would have to go to court and prove that this business did. Is that correct, in order for you to be successful in a claim?
Civil, that's correct.
Right.
I thought you said criminals. I thought you said criminals go to jail with the same standard. That's not true. Your first question, the answer is yes.
And let's break that down. That also is the highest possible in criminal or civil, is willful, malice, and intentional.
Beyond a reasonable doubt.
For criminal.
Right.
But as for civil, I guess what I'm getting at, you have negligence, right? Negligence is you just negligent. Then you have gross negligence. Then the highest burden you have is intentional misconduct. So your hypothetical situation with the manufacturer, that would be actually gross negligence, wouldn't it be, gentlemen, and not intentional?
Well, gentlemen, I mean, that's kind of a moot point because I think it would still, if you had the actual intent and knowledge, I think it would apply. I think you would be. You see what I'm saying?
Intent or knowledge to do what? Your intent and knowledge have to be to give somebody COVID, not to intentionally mismanufacture a product. That's the problem with your hypothetical.
No, I think it would include the manufacturing process too.
Your bill don't say that. It says.
What line are you referring to, gentlemen?
The damages incurred or the death resulted from or related to the actual alleged exposure. The actual alleged exposure that result of actual malice, willful, intentional misconduct.
The damages, yes.
Exactly.
So I think that would be included. I think that would be covered.
Now, you also mentioned about the CDC guidelines. Show me in the bill where it actually says that. Because and maybe I read it too quick.
Section 3, gentlemen.
So the applicable public health guidance would be considered the CDC guidelines.
I didn't use that exact language, but I mean, that means that's including the CDC guidelines. That's correct.
Gentlemen, I've tried to think of any possible. I mean, this bill basically giving total immunity as it relates to anything COVID related.
Gentlemen, we discussed that with the previous bill. I mean, it's not, you can read the language of the bill. I mean, with all due respect, I disagree with you. It's not providing blanket immunity. It's raising the standard of care in these cases. Specifically, hold on, gentlemen, if I may. Specifically for cases related to the COVID virus and specifically for cases that arise within that time scope that we already discussed. So it's very limited, gentlemen.
If I own a ticket booth and I work in there, it's 10 by 10 room. I get diagnosed.
Okay.
Okay. I got 2 other employees working with me. I want to make money. I go to the ticket booth, work with my 2 employees. I put a mask on. Will I be held liable?
Well, I mean, so who's got...
If one of my employees have come down with COVID-19.
Well, that's in, gentlemen, you know as well as I do, that would be within the workers' compensation. I mean, you deal with, hold on, gentlemen. I'm going to answer your question. Yeah, you know the answer to that question. That's a workers' compensation case. You're dealing with the liability or the, you know, the workers' compensation liability of an employer as it relates to the employee, and that is not being modified or changed by this law.
Okay, how about I have a customer or a client coming to buy tickets, and he come up in that 10 by 10 room. I have COVID with a mask on. Not only do my clients my employees get sick, but the customer comes in and gets sick, and he or she can prove they contracted from me. Would I be held liable under this bill?
Oh, gentlemen, that's a pretty speculative hypothetical. I mean, so you've got an expert witness involved. You're able to prove causation. I mean, the owner is obviously following. There's a good faith effort to follow the guidelines by wearing the mask. I mean, I think that person would be immune. I think you're looking at...
He would be immune.
Yeah, if he or she is wearing, I mean, you know, without going into the causation aspect of it, I mean, if they're following the guidelines, wearing the mask, yes.
What if I don't wear a mask?
Well, gentlemen, the same
thing. And I guess what I'm getting at, gentlemen, you smell what I'm stepping in. You're trying to get around it, but
well,
I guess
I'm trying
my
to
point
answer your
is
questions fairly, too, and in a way that's going to benefit, you know, the explanation of the bill to the members. I mean...
And with that hypothetical, gentlemen, it would basically get in my mind what my intent is. If my intent is to go in and make money, not to give my client, not to give my customers COVID, then I'm not liable on this bill. I have to specifically go to work, and my intent have to be to infect somebody in order to be liable under this bill.
No, your intent has to be with a forethought and with malice to not follow the guidelines and to do...
I could vote for what you're saying, but your bill don't say that.
I think it does, gentlemen.
Show me what line, what paragraph.
The good faith compliance with the CDC guidelines. I mean, if you don't follow those guidelines intentionally, okay, and if you can meet that standard of proof concerning the damages, I think that business owner, I think the manufacturer of that product will have some type of liability.
Thank you, gentlemen.
Sure.
Lady from Hines, Ms. Yates.
Will the gentleman yield?
Yes, ma'am.
All right. Going to the previous discussion where you were referencing good faith compliance with CDC guidelines, that is on line, let's see.
I believe that's in section
69, section 3.
Section 3, that's correct.
Yeah. It says that no person who attempts in good faith to follow the public health guidance shall be found to have committed actual malice or willful or intentional misconduct. So that's contrary to what you just stated a moment ago. because this specific sentence says that if you in good faith comply with the guidelines, you cannot be found to be intentional. Correct?
Gentlemen, lady, sorry. That's not, read the following section, section 2. This section, okay, section 3, shall not apply if the damages, injuries, or death resulted from or related to the actual or alleged exposure to COVID-19 is shown by clear and convincing evidence to be the result of actual malice or willful or intentional misconduct.
Right, that's section 2. And then we go to section 3.
That applies to all of section 3. This section does not apply if you can meet that standard of proof.
But that's not what it says, because if you look at line 69, it essentially has a but in front of the word. But if you have a person who attempts in good faith to follow the public health guidance, they can't be found liable. And that's proven by your very next section, subsection 4, that starts on line 73. That says that if you fail to comply with public health guidance, it's not sufficient to establish that the person committed actual malice, willful, or intentional misconduct, correct?
That non-compliance has to be willful.
But you already said that you have to have willful non-compliance to begin with, so is section line 73 through 76 at all necessary?
I think it is necessary, lady.
Why?
Because it shows, it provides, it makes it clear that if we have that product's manufacturer or the business owner showing good faith, then he or she is not going to be liable.
But that's already addressed in 2 previous sections above, correct?
It's a little bit different. I mean,
how?
Well, because on subsection 3, it goes on to say, shall be found to have committed shall not be found to have, okay, I'll read the whole thing. No person who attempts in good faith to follow applicable public health guidance shall be found to have committed actual malice or willful or intentional misconduct under this section.
Correct. So and that's the section above the one that we're discussing now. So if you have a business owner...
Well, actually, it's a section below.
If you have a business owner who makes a good faith attempt, okay, which is good. I'm glad that they're making a good faith attempt. But as long as they do that, this bill says that they can't be found liable because their intent is not there.
Well, lady, again, I think even if you have a good faith attempt, then you don't have, they kind of go hand in hand. If you have a good faith attempt, then you don't have the intentional conduct to not follow the guidelines. You see what I'm saying?
I agree that is what the bill attempts to say. But under that same rationale, explain to me why lines 73 through 76 are necessary.
Well, lady, I mean, it's compared to what's the good faith language where? Compared to what?
The language that you just explained to all of us that's in the bill, that if there is good faith compliance, then that is proof that there is no intentional act.
I think it's further clarification.
I think further confuses the point and attempts to add another loophole.
I think it's further clarification on liability and the standard of proof, lady. I mean, I don't think you can...
That paragraph doesn't address the burden of proof.
Well, but further clarification on the immunity if someone, if there's a good faith...
That's the perfect word that we're looking for.
Yeah, clarification on the immunity. Further clarification on who will be immune under this law.
And if you read lines 69 through 76 in conjunction, there is no reason that any business owner would need to have good faith compliance with the CDC guidelines, because lines 73 through 76 say that non-compliance is not enough to show that they're liable.
No, not just sheer non-compliance would not be enough. I agree with you, lady.
All right. Mr. Speaker, I have an amendment at the appropriate time.
Jim from Forest, Mr. Watson.
Thank you, Mr. Speaker. With my good friend, the gentleman from Jackson, would you yield, please?
Yes, sir.
Good morning. How are you doing?
Good morning. I'm doing great. How about yourself?
Oh, pretty good. Would you agree with me that the exposures that we are talking about giving liability for, these exposures are protected by insurance?
I'm sorry, are protected by what?
Insurance. You can purchase insurance to protect yourself from lawsuits of this nature.
Gentlemen, I think you can even purchase, well, I'm not sure about that. I would say generally yes, but I'm not sure.
Okay, all right then. And
are you referring to the specific purpose of protection from virus, COVID-19 related cases?
From liabilities of this nature, yes, sir.
Well, from liability insurance as a whole in general, yes.
Okay, but if this bill passes, basically there would be no need to purchase insurance because there would be no liability. Would I be correct?
Gentleman from Forest, former chairman of Ways and Means, again, I just respectfully disagree with your premise. I think there would still be the need. We're only increasing the standard of proof. Okay. We're not providing blanket immunity in these cases.
Okay, now, would you agree with me, and just think before you answer this question, that we, in considering this bill, we're trying to make it all but impossible to be successful in a lawsuit that's based upon this virus? Just tell us the truth so we'll know.
Gentlemen, I would disagree with you. I would respectfully disagree. We've got a situation that has never been experienced by any of us before. We've got a situation, if I can delve into the legal aspects of it, and you're a very competent attorney yourself, but because of the causation issues, gentlemen, involved in these cases, and the exposure rate, and you know what I'm talking about. Okay. I mean, and I mentioned it before from the gentleman from, I believe, Covington. I mean, if you don't do something and if you just open the floodgates, then you're looking at a very serious situation with our judicial and legal system.
But I agree with you that we're dealing with an unknown situation, but we are passing a law to provide protection for something that we really don't know enough about to provide a quarantine to prevent. Would you agree with me on that?
Again, we know that it's the way it's spread, and gentlemen, we're not providing. Everyone keeps saying we're providing complete protection. And I keep going back to the fact that, gentlemen, I mean, it's not blanket immunity. I mean, and I think I've explained that before. We're simply raising the standard of proof for a specific type of case and for a very limited time frame.
Okay, all right, thank you, sir. How close is it to blanket immunity?
Well, I mean, that's hard for me to say. It's closer than what the present standard of proof is. We are raising the standard of proof, but it is not blanket immunity.
But you will agree with me, it's very, very close to blanket immunity.
I would not agree with you that it's very, very close. I would agree with you that it's closer than the preponderance of evidence. A 50-50 balancing act.
Okay, what's the difference between preponderance and clear and convincing evidence?
The standard's a little bit higher.
It's much higher. Okay.
It's higher, gentlemen.
Thank you, sir.
Sure.
Now, this bill, who does it protect? Now, it says it protects businesses, but who does it provide protection to?
Well, not just as I mentioned earlier, gentlemen, it also includes manufacturers. I believe that was in Section 5.
Okay, and individuals, am I correct?
Yes.
And individuals?
Yes, Section 4 is the manufacturers, I'm sorry.
Thank you, gentleman from Jackson.
Sure.
Mr. Chairman.
Gentleman from Adams, Mr. Johnson.
Thank you, Mr. Speaker. The gentleman yield.
Yes, sir.
Gentlemen, I was reticent about asking questions because everybody else did a great job, but you gave us a scenario that I want to go back to. When you talked about a manufacturer manufacturing mask, you remember that scenario you gave the gentleman from Smith about if you had this situation, how this would apply? Do you remember that?
I do.
And you said that, and I want to make sure I got this right, that if you're manufacturing a mask or say some sanitizer or something like that, and there are guidelines that you're supposed to follow, and you, in an effort to save money or to cut costs, you didn't follow those guidelines. Did you say something to that effect?
It wasn't about guidelines. It was more that person had actual, let's just use a sanitizer. That person had knowledge that he or she was trying to save money and excluded in the manufacturing process certain chemicals. Now, this is just my hypothetical. Hypothetical. Excluded certain chemicals because they were expensive and marketed the product that it included those chemicals. The only way that product would be effective, gentlemen, if it had those chemicals and he or she intentionally left out those chemicals. That's the type of hypothetical.
Okay, well, you do understand. You understand that in the medical community and in medical devices, whether it's mask or medicine or sanitizer, that there are certain requirements that the government outlines that you have to follow when you're manufacturing or representing that you're manufacturing a piece of equipment or a device or anything that's supposed to meet certain safety standards. You understand there are governmental guidelines for that. Am I right?
Well,
You know that to be true. Everybody in here knows that to be true. That if I manufacture, for instance, this right here is a N95 mask. If I put on there as an N95 mask, that means that it meets certain requirements that an N95 mask has to meet. Isn't that correct? Isn't that correct?
Guidelines? I don't know if there's federal guidelines.
All right, well, hold on. Let me finish. For the sake of argument.
Hold on. Once I heard your
question. Are you telling me that you don't know that an N95 mask has to follow certain guidelines?
Gentlemen,
now, I know you know that.
I'm not saying that. I'm saying none of that specific.
That was my question. Does an N95 mask have to follow certain guidelines? And you won't answer that question.
I don't have personal knowledge.
All right, well, I won't ask. Let me ask the question this way.
Hold on. I do not have personal knowledge as to what those guidelines are, or if there's guidelines present that need to be followed on that certain mask. I mean, I don't have personal knowledge.
Okay, all right, that's fine.
Of whether those guidelines exist or not.
For the sake of my question.
Okay.
For the sake of my question. N95 mask. The government has represented that this is a mask that you should wear if you're trying to be safe. And an N95 mask is not like, say, let me find this other one I got in my pocket. It's not like the one that I would make if I put this flag over my face. It's not the same. You understand there are two different masks.
There are two different masks, but gentlemen, you're telling me that the federal government is telling us or has mandated that the N95 mask is the type that needs to be worn?
Well,
is that what you just said? I don't think that's the case.
No, I said the recommendation from Dr. Fauci, Dr. Dobbs, from the health department is that an N95 mask is what you should
Gentlemen,
wear.
I think you're wrong. I don't think he's specifically recommending a N95 mask.
Okay, all right. My question is, you've practiced enough products liability to know that there are certain standards that certain products have to follow.
I don't practice that much, no. I don't, not products
you
liability.
You just represented that you both, everybody, that as lawyers, we understand what products liability is. You understand what you mean.
You should, that's two different questions. Do I practice that? Do I have that type of practice? No. Do I know what the
maybe I'm giving you too much credit. In law school, did you understand what products liability
Do I understand the general principles involved in a products liability case?
That's my question.
I do, gentlemen.
Okay, thank you. I know you do.
Every other attorney should know that too.
I know you do. And so when I ask that question, I'm asking because Section 4 in there says that failure to follow guidelines alone will not hold you liable. So you're telling me that if I have, that the manufacturer in the scenario, let me finish my question. The manufacturer in the scenario that you gave in your example to the gentleman from Smith failed to follow the guidelines for whatever reason, whether he was cutting costs or whether he wanted to get them out fast, but he failed to follow the guidelines, and he sold a mask, or he sold a sanitizer, or he sold anything that he represented that would do the job that it said it would do. And under this bill, you say failure to do that, willingly failing to do it, does not meet the standard under which you can be held liable. No, I'm just asking a question.
Hold on, because the premise of your question is completely incorrect. On one side, hold on, I'm going to tell you why. Hold on, because on one side, you're talking about the guidelines involved in the manufacturing process. The guidelines that we're referring to in this bill, and it's very clear, are referring to following a good faith following of the CDC health guidelines. They are completely different, gentlemen, and you know that. It's spelled out, it's clear in the language of the bill.
Well gentlemen, you're exactly right. You answered the question for me. That the CDC has guidelines. The CDC says to a business, says to a manufacturer. CDC's, they have CDC guidelines.
But they're two different guidelines, gentlemen. You're talking about the manufacturing guidelines.
No, I'm talking about your scenario. I'm talking about your scenario. I'm talking about your scenario.
I'm talking about
and I'm talking about
healthcare guidelines issued by the State Department.
This won't work. Everybody here knows that you're making it up. But this is what we're going to do. I got an amendment at the proper time, Mr. Speaker.
When that hammer bangs, that means silence.
And I have an amendment at the proper time, Mr. Speaker.
Now look, we can't talk at the same time. The gentleman at the well can answer questions or he cannot. He can yield at any time. He can present in any manner that he sees fit. And if you don't, this is not a court of law. If you don't like the way he answers the question, I can't help you. All right? That's everybody. No, sir. Jim from Washington, Mr. Hines, you're recognized.
Thank you, Mr. Speaker. Classmate, do you yield?
Yes, sir.
I'm interested in something. Would you not agree with me that the Food and Drug Administration sets certain standards for and guidelines that we're supposed to abide by in this country?
As prescription medication and whether or not it can go in the market? Yes, sir.
Okay. So were you aware that the Food and Drug Administration warned the public about 9 hand sanitizers that were toxic to Americans? And were you also aware that these sanitizers cause certain symptoms such as nausea, vomiting, headache, blurred vision, permanent blindness, seizures, comas, permanent damage to the nervous system, and the grand poobah, death? Would these companies have complete immunity? Do they have complete immunity? If they cause me or my children or my mama or my wife or my brother or my sister to die, would they have complete immunity? Yes or no?
Okay.
Well, that's all I want to know. Yes or no? We ain't got to go into a long diatribe. Yes or no? Would they have complete immunity?
Gentleman from Washington, you had 2 questions. I'm going to answer both of them with a yes or no. Did I know that? No. Would they have immunity? If you could meet that standard of proof, they would not.
So,
okay? If they
so
cannot,
this hand sanitizer right now, gentlemen, this one right here, if I use this and it messed up my nervous system,
I'm answering your
will
question.
my wife be able to sue on my behalf? Yes or no?
Well, you can sue. I mean, there's nothing to stop you from suing. If you're going to be successful, if you're going to get through, motions for summary judgment, dispositive motions that attorneys know about, if you could meet that standard of proof, then that person would face liability. If you can't meet it, that's what we're trying to do. We're trying to clarify that standard of proof. If that person cannot meet that standard of proof, then that plaintiff will not be responsible.
Gentlemen, again, and this is simple. Most of us in here are lay people. We're just simple, everyday men and women trying to work, trying to provide coverage for those people who entrusted us to come down here.
Yes, sir.
And so if Joe Q. Public walked into CVS and bought some hand sanitizer because it was $1 cheaper than what the other hand sanitizer was, and went home and used it and damaged his nervous system, or he got sick, or God forbid he passed. According to the guidelines from the FDA that said these ones are toxic, would his wife or family member be able to receive some form of relief?
Gentlemen, again, the answer to that is very simple. If that plaintiff's attorney can show and can prove that that nerve damage, can show by clear and convincing evidence that the nerve damage was the result of actual malice, willful, or intentional conduct, then yes.
So I'm glad you said that. So if I intentionally do not put the right ingredients inside of my product, intentionally, and it causes the things in which I just described, will I or will I be sued because I didn't do what I was supposed to do? Yes or no?
I'm not a judge here.
So would I have complete immunity?
I'm not a judge. I can't tell you in that specific case,
You know what, gentlemen?
Hold on. I'm not a judge. I cannot tell you in that specific case whether or not you are going to be successful.
You know what?
I can tell you, okay, that as it relates to the COVID virus and as it relates to the specific time frame that we're talking about, gentleman from Washington, my classmate colleague, if you can meet that standard of proof and prove the causation for those damages, then possibly yes.
Gentlemen, are you looking for some immunity right now? Because this piece of legislation does not do anything to protect the common everyday person. And that's what we're down here for. Would you not agree with me that we are down here to look out for the best interest of the Joe Q public? Would you not agree with me on that?
I think it protects everybody, gentlemen. I think it protects the individual citizens. I think it protects the manufacturers, the individual citizen, the business owners, everybody.
Gentlemen, well, we just disagree on this. Mr. Speaker.
Yes, gentlemen.
I'd like to speak against this piece of legislation so everybody can know what companies are being involved in. They finna set off the hook for killing folks.
You'll be recognized at the proper time.
Mr. Speaker.
Lady from Pearl River, Ms. Hopgood, for what purpose?
Thank you, Mr. Speaker. Gentlemen, will you yield?
Yes, ma'am.
Gentlemen, wouldn't you agree that this is a fluid situation and that we have put, like most business owners intentionally would never harm their consumers?
Without question, lady.
Wouldn't you agree with that?
Yes.
And wouldn't you also agree that if they were intentionally trying to harm, that it would harm their business down the road?
Very good point.
And wouldn't you also agree that we have, in good faith, put a lot of money from the CARES Act into our businesses, including minority businesses, to help them get back on their feet? And wouldn't you agree that by not protecting these businesses with this legislation, that could actually harm them and be the worst thing we could do for Mississippi right now?
Without question, lady.
Thank you, sir.
Very good point. Mr. Speaker.
Yes, gentlemen.
I yield the floor.
Gentleman yields the floor. I believe we've got some amendments. Lady, you're recognized for your amendment.
Mr. Speaker, I'd like to have the amendment read.
Madam Clerk will read the amendment.
Amendment number 1 by Representative Yates. Line 67, delete clear and convincing evidence and replace with a preponderance of the evidence. On line 73 through 76, delete. On line 77, delete 5 and renumber as 4.
You're recognized, lady.
This bill seeks to provide immunity to business owners. I am a business owner. I own 2 different businesses. I don't need immunity because I need to be a good business owner and I need to do what I'm supposed to do. That means in everyday life, and that means right now, in times of crisis, if I'm going to have my business open, I need to do what I'm supposed to do. I at least need to try and make a good faith effort to do what I'm supposed to do if I'm going to invite you, the public, into my business. This bill essentially tells business owners that they can do whatever they want without consequence, and it doesn't matter if it injures your mama or your neighbor or yourself or your husband. This is not a good bill and is not what it's meant to do. The amendment that I'm proposing simply changes the burden of proof from clear and convincing evidence to preponderance of the evidence. Any attorney in this room knows that preponderance of the evidence is the burden that's used in 99% of civil cases. That is the burden that we should be using if we're going to pass a bill anywhere close to this. We've also been told previously that we have no idea how much this is going to clog the court systems because we don't know what's coming. We are attempting to pass legislation for something that hasn't even happened and may not happen. We have no idea if these cases are going to clog the court system. This bill will not keep people from filing lawsuits. You can still file a lawsuit. Those lawsuits will still go to the same courts. We have to find a balance between protecting our small businesses and protecting the people in this state that you represent. No one in here has a district that is made up of nothing but small businesses. You have everyday common people that go to those businesses. You have a duty to protect those businesses and those individuals that frequent those businesses. I'm asking you to support this amendment because we do not need blanket immunity for small businesses in this state.
I don't see any questions on the amendment. The gentleman from Holmes has asked to speak on the amendment.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, I rise in support of the lady's amendment. She's exactly correct. This bill, the way it's written now, is basically blanket immunity as relates to anything that relates to the COVID-19. And the amendment that she's proposed, although it don't do much in writing, it does a lot as it relates to the bill. I think it's closer to being the bill that was actually explained to you all today from this podium. And let me tell you, if you don't believe that it's a total immunity, it's written in the bill. The bill clearly states that it is a immunity bill. It says it shall be immune from suit, from civil damages of any injuries. Then it goes on to give about 4 exceptions to this. It is an immunity bill. And the way that it's written, you're virtually not going to have anybody in the state of Mississippi with any claim could come close to even being able to survive a motion for summary judgment. And I'm finna sit down, but let me tell you what a person would have to be faced with as of today. The burden of proof for cause and causation is on the plaintiff. The person who filed a lawsuit have to prove it. I have to go to court and I have to prove that I didn't get it from Walmart, I didn't get it from my wife when she came home, I didn't get it from this chamber. I would actually have to prove that business gave it to me. I contracted as related to the business. It's almost virtually impossible to do that now. So really, there's no need for this bill. But if you want this bill to be the bill that was explained to you from this podium, then you need to support the lady's amendment. Her amendment fix some of the problems of this bill and will still give a slight fighting chance for the citizens of this state. Thank you, Mr. Speaker.
Gentleman from Jackson, do you wish to respond?
Thank you, Mr. Speaker. Briefly, ladies and gentlemen, again, we are not, let me state this one more time, we are not providing blanket immunity. We are increasing the standard of proof. We are in unknown times. How this virus, the causation is very questionable. How, the spread of the virus, so on and so forth. Do you just want to shut down all the businesses? Is that what you want to do? We're only increasing the standard of proof. That's what this bill does. It's in black and white. It's simple. It's a short bill, and we oppose the lady's amendment. Thank you.
Lady, you wish to close on your amendment?
Just briefly, no one is asking us to shut down businesses. In fact, it's the exact opposite. This legislative body voted to give $300 million to small businesses that they could use to make their businesses safe to reopen. That is what they should be doing. For us to give that money to small businesses and then tell them that they can use it for whatever they want, essentially, because they can't be sued for not using it, is complete farce. And that's not who we should be as a body. If you want a bill that protects small businesses and protects the people in your state, at a minimum, you should support this amendment.
Question recurs on the adoption of Amendment 1. If you favor the amendment, vote aye. Opposed, vote nay. Noes have it. Noes have it. Roll call is demanded. There is sufficient number. Open machine, Madam Clerk. Has everyone voted? Has everyone voted? Has everyone voted? Close the machine, Madam Clerk. By a vote of 49 yeas, 68 nays, the amendment fails.
Final passage, Mr. Speaker.
I believe we got a gentleman from Adams has an amendment.
Sorry.
Gentlemen, you want to explain your amendment or you want to have it read?
Yeah, just have it. Well, I can explain it.
You're recognized, gentlemen.
Thank you. Ladies and gentlemen, I understand what they're trying to do with the bill. And when I was trying to make the point and ask the gentleman when he was up here, if you're trying to make sure that people are not sued when they follow all the rules and the guidelines, that's fine. I think that's an excellent way to approach business, especially in this pandemic. But why do you need a section if you're following the guidelines on line 73 through 76 that says no person who attempts in good faith to follow applicable public health guidance shall be found to have committed actual malice, willful, and intentional misconduct under this section. And then it goes on to say failure to comply with public health guidance shall not be sufficient to establish that a person committed actual malice. My amendment takes that section out. And the point I was making is a mask, a sanitizer, all of them do have to follow certain guidelines. What this bill says is I can sell you an N95 mask. I can sell you sanitizer that says it cleans what it's supposed to clean. And I can do it, and I could have manufactured that without following any of the guidelines that they say you have to follow. And this bill says that you can't be held liable for that. I don't think that's necessary to protect small businesses. As a lady from Hines said, we gave money to small businesses, gave them help to make sure that they could have the necessary products, everything they need to clean those businesses. Somebody sells them something that doesn't do the job that the regulation says that it is supposed to do, then we are not only holding the manufacturer immune, then the business, that the person that may end up being sued is the business. You're not protecting the business. Somebody has to be held responsible for making sure that when we rely on something, it does what it says it's going to do. And 77 through 79 doesn't do that. It leaves it out. I think this bill can do what the gentleman says it can do without holding you completely immune from any responsibility to follow any health guidelines. So that's all my amendment does. I'd ask for adoption of the amendment.
Chairman, wish to respond.
Yes, Mr. Speaker. Quickly,
You're recognized.
The gentleman's amendment does not accomplish what he wants. Again, read the section. We're dealing with health care guidelines, not manufacturing guidelines. So I would urge you to oppose the amendment.
Well, that's just not true, because the gentleman said that the bill covers manufacturers, and manufacturers have to follow health care guidelines as well. A manufacturer that's manufacturing a product if it's a product that's supposed to protect your health, he has to follow health care guidelines. And so he's contradicting himself. It's just not what it does. My amendment would say that if you have to follow health care guidelines, those guidelines have to be followed. And take that section out, and all anybody has to do is what we gave small business and manufacturers money to do, and that is, here's the money. Get your business open, but when you open, clean it, sanitize it, provide a safe environment for people coming in there. And I think every business in the state wants to do that. We just want to hold the ones who don't want to do it or who refuse to do it, hold them liable. That's all that does. Takes 3 lines out, and people still have to meet a higher standard under the law. They still have to meet, they still are held immune if they do and follow all the rules, which they don't have their protection now. All I say is, if you do all those things, you shouldn't be sued. What his bill does say, if you don't do any of those things, you still won't be sued. And that's just not right. That's just not right. So I ask you for adoption of the amendment. Thank you.
Question recurs on the adoption of amendment number 2. If you favor the amendment, indicate by saying aye. Aye. Opposed, no. No. Noes have it. Noes have it. Roll call is demanded. There is sufficient number. Open the machine, Madam Clerk. Has everyone voted? Has everyone voted? Has everyone voted? Close the machine, Madam Clerk. By a vote of 52 yeas, 65 nays, Amendment 2 fails. Anything further on the bill, Mr. Chairman? I believe the gentleman from Washington, Mr. Hines, wants to speak against the bill. Almost missed you, gentlemen. Come on down.
Thank you, Mr. Speaker. Ladies and gentlemen, I just wanted to share this information with you so you can't say you didn't know when you take this vote and you go back home and somebody has passed. The FDA has identified the following 9 products which contain menthol. Menthol causes an effect that's inside the hand sanitizer that causes problems. So one of the products is All Clean hand sanitizer, Escobicium hand sanitizer, Clean Care No Germ Advanced Hand Sanitizer, Lavar 70 Gel Hand Sanitizer, Good Gel Antibacterial Hand Sanitizer, Clean Care No Germ Advanced Hand Sanitizer, Clean Care No Germ Advanced Hand Sanitizer 75%, Clean Care No Germ Advanced Hand Sanitizer 80%, Sandurum Advanced Hand Sanitizer. And this is what the FDA says. And people are buying these things or have bought them not knowing that it was toxic to them. Customers who have been exposed to the hand sanitizer in question are advised to seek immediate treatment in order to reverse the toxic effect of the menthol poisoning. Symptoms include nausea, vomiting, headache, blurred vision, permanent blindness, seizures, comas, permanent damage to the nervous system, and death. Now, when you vote on this, and if it passes, y'all just told a company that produced these hand sanitizers, we got you. Don't worry about it. The massacre in which you just did, you good to go. Now, I'm a movie buff. I love good movies. And one movie that I enjoy watching over and over again is A Few Good Men. And I'm a big Jack Nicholson fan and Tom Cruise fan. And there's a scene in this movie that hits this perfectly. Gentlemen, you want me on that wall, and you can't handle the truth. The truth about this piece of legislation that's being presented. Y'all getting the companies that produce these 9 hand sanitizers complete immunity for killing our folk.
Anything further, Mr. Chairman?
Quickly, you can't handle the truth. The truth, again, we are not providing complete and blanket immunity. We're simply raising the standard of proof. We oppose the gentleman's amendment.
We're past that point, gentlemen. We're to the point. Gentleman's yielded the floor and moves final passage on 1783. Open the machine, Madam Clerk. If you favor the bill, vote aye. If you're opposed, vote nay. Has everyone voted? Has everyone voted? Close the machine, Madam Clerk. By a vote of 72 yeas, 43 nays, the bill passes. Anything further, Mr. Chairman? Rules yields the floor. Announcements, Madam Clerk. We're done. Announcements by the members. Gentleman from Jackson, Mr. Anderson. For what purpose?
Request, Mr. Speaker.
State your request.
Thank you. On yesterday's calendar, I'd like to request unanimous consent for the concurrence, non-concurrence calendar, item 5, House Bill 1295, to be recorded for myself and my desk mate from yes to no. The gentleman from Lauderdale. Thank you, Mr. Speaker.
There's no objection. Change the gentleman's vote. Lady from Hines, Ms. Yates. For what purpose?
I'd like to request that HB 1779 and HB 1783 be held on a motion.
Thank you. We'll do that. Gentleman from DeSoto, Mr. Hopkins.
Thank you, Mr. Speaker. I'd like to ask unanimous consent to change my and my desk mate's vote from yay to nay on item number 1, SB 2906, the local and private.
With unanimous consent, change his vote. Gentleman from Lee, Mr. Thompson. For what purpose?
Thank you, Mr. Speaker. I'd like to change my vote, make a request to change my vote to House 1295 to my desk mate Carl Gibbs and John Fault to no. To nay.
Change them to no.
Right.
Change the gentleman's vote. Gentleman from Pike.
Thank you, Mr. Speaker. Just a quick announcement for the members. Just a reminder that Mississippi Blood Services will be out front Thursday from 10 a.m. until 4 for blood donations. If you can donate, they would very much appreciate your help.
Gentleman from Jefferson, Mr. Harness.
Adjourn in memory.
You're recognized.
I'd like the House to adjourn in memory for Darius Thompson, who's a former football player of mine who succumbed to cancer 2 days ago.
Thank you, gentlemen. We'll do that. Lady from Lowndes, Ms. McLean.
Thank you, Mr. Speaker. I'd like unanimous consent to change my vote on HB number 1685 from earlier today from yes to abstain. Present.
There's no objection. Change the lady's vote. Gentleman from Adams, Mr. Johnson.
With unanimous consent, I would ask to have my vote changed on House Bill 1295 from yay to nay.
No objection. Change your gentleman's vote. Gentleman from Marshall, Mr. Faulkner.
Adjourn in memory, Mr. Speaker.
You're recognized.
I'd like for the House to adjourn in memory of Miss Angelina Cheers. Thank you.
Thank you. We'll do that. Lady from Jones, Ms. Scott.
Thank you so much, Mr. Speaker. I'd like to ask the House to join me in adjourning in memory of Mrs. Emma D. Sanders. Mrs. Sanders, as you all know, is the mother of the attorney Everett Sanders. She is also the grandmother of Keelan Sanders. And Mr. Speaker, she is a longtime Democrat that has worked with everybody you can name, from Winston Hudson, Fannie Lou Hamer. This is the kind of history that we lost today. So we'd ask the House to also pray for the family.
Thank you. We'll do that. No other announcements by the members? I have one. Management is going to have a quick meeting in the rules room immediately upon adjournment. Promise I won't keep you 5 minutes. I don't see anything further. I recognize the gentleman from Prentice for the motion.
Mr. Speaker, I move this House stand adjourned until 10 a.m. Thursday, the 25th of 2020, and that the journal shall remain open until every committee conference report is received.
You've heard the gentleman's motion. If you're in favor of the motion, indicate by saying aye. Opposed, no. The ayes have it. House is adjourned till 10 a.m. tomorrow.